Gracious. Can someone tell me if you can see one slide or two slides on the screen?
Two slides.
Thank you. Let me fix that. How's that? One slide or two?
One.
Thanks. So I think we'll get started. It's 7 o'clock, and I appreciate those of you who made an effort to get here on time. So welcome to Therapy Ed's online office hours. It looks like all of you have yourself unmuted. Thank you for that. If you do have a question, you can either unmute yourself or write your question in the chat box. Now, I may not see that chat box, so if it's been a few minutes and I haven't acknowledged your question, please go ahead and unmute yourself and say, I have a question, and I'll be happy to answer it. So my name is Donna Costa. I'm one of the 24 or so Therapy Ed instructors. who teach occupational therapy and occupational therapy assistants material related to passing the NBCOT certification exam. Together, we offer 2-day courses, we offer tutoring services, we offer these online office hours. We contribute to writing test questions and preparing products for Therapy Ed. I've been with Therapy Ed about 18 years, and I've been an occupational therapist for over 50. My clinical practice area was mostly in mental health for over 35 years. And I've been teaching in a variety of academic settings for the past 25 years. I'm starting to move towards retirement, but I've been with Therapy Ed a long time, and so I'm hanging on to that one. So over the years that I've been with Therapy Ed and seen the changes in OT education, we've heard numerous students talking about test anxiety, and this seems to be getting worse rather than better. It seems that more and more students are feeling that test anxiety is getting in the way of their being successful on the NBCOT exam. So we thought it was time to address it head on in a session. This session is being recorded, and so it will remain on the Therapy Ed website for a bit. For those of you that want a little more information about strategies, next week's session I will also be giving, and that will take a deep dive into the area of mindfulness. So here we go. So over the past 10 years, we've seen rather dramatic increases in students presenting, particularly with anxiety and depression. And college and university counseling centers have been reporting dramatic increases in the numbers of students seeking services. That leads to as many as 1 in 6 undergraduate students in the US either having been diagnosed with or treated for anxiety. Anxiety also affects graduate students and students in the health professions, medicine, dentistry, nursing, PT, OT. They tend to have higher levels of anxiety when compared with the general population. And in particular, as they prepare for this certification exam that we have in OT. This is one of the exams that we call a high stakes exam, because many of you who are getting ready to take the exam will report that you have a job waiting for you. You have student loans waiting for you. You have your life waiting for you. And so that puts a lot of pressure on students to perform at their peak. So we're going to look at this topic in detail tonight. The effects of anxiety on all students, but in particular on graduate students, is multifaceted. We know that when people are anxious, it leads to decreases in their academic performance. It can lead to decreases in professional skills, and it can lead to decreases in empathy. And there's been a number of studies in medicine in particular, looking at the effect of anxiety on professional performance and academic performance. Okay. This is just an example. The American College Health Association does a survey every year, which they publish. This last one was from 2022. And it reported that more than 1 in 3 students have reported being diagnosed with an anxiety disorder. 1 in 3, with 35% of students reporting anxiety as a factor that impedes their academic performance. Okay, so this is very widespread. So exactly what is anxiety? Probably don't need to define it because you've probably all experienced it at one point or another. But it is characterized by persistent, intrusive thoughts, thoughts that you don't have much control over, or so it feels. Concerns that lead you to enter this cycle of worry and tension. So it's been described as having a disproportionate amount of worry and fear relative to everyday situation. So we know college life is stressful, but you have a great deal of worry and fear associated with it, more than one would expect. And this leads to adverse thoughts and predictions about future. So if you're worrying about your current level of academic engagement, then you start thinking about what's going to happen. And usually, most people do not think in terms of positive thoughts. The majority of us think in terms of the negative. And then we start spiraling, right? The what ifs start piling up. So these repeated patterns of heightened worry and fear further introduce consequences such as poor health outcomes. Okay, that the toll of anxiety becomes very prevalent in our bodies and in our minds. It leads to sleep disturbances and it leads to impaired cognitive performances. So this can be you blank out, you have trouble making a decision, you have trouble focusing your attention, and the list goes on. So we know that entering college and or university life is a milestone in a person's life. And it represents a period of increased responsibilities. You're transitioning into adulthood. And during university life, you're trying to strike a balance between things like academic performance, extracurricular activities, personal relationships, romantic relationships, finances. And I'm sure many of you work part-time or even full-time jobs. So these central elements to college and university life forces us to need to adapt. We have to achieve that optimal work-life balance. And that's easier said than done. And we have to do that in order to cope with the daily stress, which is mounting. But again, this phase of student life is often characterized by prevalent mental health problems such as anxiety, depression, sleep disorders, eating disorders, among others. Now, what happens if you're wondering why I'm pausing, every time somebody comes into the room, the slide deck gets interrupted and then I have to reset it. So pardon me. So let's look at test anxiety, which is a little different. Okay. Anxiety, as I'm sure many of you know, having taken psychology courses, is a disorder that leads to a diagnosis that's actually in the DSM-5, okay, as is depression. Test anxiety is not a diagnosable condition. At least it isn't at this point. We know that college life is characterized by having lots of exams, and we all tend to feel a bit nervous in anticipation of those exams. But we can have extreme feelings of anxiety and stress, both before and during an exam, and this can have unhealthy results. It can lead us to not being able to do our best, or causing us to feel anxious all the time, or it becomes extreme. So test anxiety is a combination of both physical symptoms and emotional reactions. And together, those interfere with your ability to perform well on tests. And many students experience various levels of test anxieties for a number of different reasons. This is not one size fits all. Now, I will have this PowerPoint posted on the Therapy Ed website so that you'll be able to reference the links embedded. I will tell you that most universities and colleges these days have mental health counseling centers, and almost all of them have information on test anxiety. So I've taken some of that information and, of course, referenced it where appropriate. So again, what is test anxiety? That heightened anxiety level around taking a test. Okay, so it's a response to something impending that we don't view as positive. We don't think, oh, wow, what an opportunity to see how well I'm doing. No, we're scared, we're worried. And so there's a negative association between that level of anxiety and your academic performance. Anxiety goes up, academic performance goes down. This has been shown in numerous studies in both graduate and medical students, but also in undergraduate students. So there is a test which I invite all of you to take if you're curious. It's called the Westside Test Anxiety Scale. It's available in the public domain for free. And it has 10 questions associated. 6 of them measure incapacity. So memory loss, poor cognitive processing. 4 of those 10 items involve worry or catastrophizing. For those of you who've never heard the term catastrophizing, it's making something bigger than what it is, okay? That does not mean you're imagining it. That means that you're attributing more to it than other people might, okay? And that's an important differentiation. Some people think that means it's all in your head. No, it's not. You're not willing it upon yourself. So there's 10 questions on this scale. You rate yourselves on a 5-point Likert scale, with 1 being never true or not at all true, to a 5 being extremely or always true. And then that total score is divided at 10. And so you might get a score, and on the same sheet as the test items, it actually tells you what the scores mean. So generally, a score more than 3.0 is moderately high anxiety. And so there's a recommendation that you take some kind of anxiety reduction training, okay? That means doing something more than once, actually taking a course or signing up for counseling, something like that. So the next slide, it delves a little deeper into test anxiety. Again, it's very common, it's not new, but there has been an increase in the past 20 years. So again, it's a combination of physical symptoms and emotional reactions, and those interfere with your ability to perform well on tests. So what happens? Now, if you look at the small circles around the big circles, there's a whole number of symptoms. You might experience some of them, but not necessarily. It's not like you have to have all 10 to actually find out that you have test anxiety. So we see nausea, anger, headaches, heart palpitations, fast, shallow breathing, feeling faint, fear, frustration, feelings of impending doom before the test, and an inability to concentrate. Again, not every student with test anxiety will have all of these. They may just have one or two, but they're all uncomfortable in some way, shape, or form. So if we look at test anxiety, there's three components. And the first component is physiological. This is the most overt, if you will, and perhaps the most bothersome. These are the physical symptoms that you might experience. So things like heart palpitations, your heart feels like it's going to beat out of your chest. Any number of GI distress symptoms, upset stomach, diarrhea, constipation, nausea, vomiting, all of that wonderful stuff. Muscle tension, restlessness, feeling jittery, and sleep disturbance. Those are the biggies. You might have others. Sweating isn't on there. The second component is the cognitive, okay? So with that, we see worrying about negative events, like failing a test, being put on probation, being kicked out of school, right? Memory retrieval problems. So just, you've studied well and you just can't retrieve the fact that you're trying to retrieve. Or difficulty focusing, not trusting oneself, being distractible, and even your mind going blank. So those cognitive components probably have more to do with poor academic performance than the physiological. Okay. The bigger concern, and I think the thing that gets students in trouble, are the associated behaviors. And that's the third component. So if you think about it, when you're anxious about something, the number one mechanism that people use is to avoid, right? I'm afraid of the dark, therefore I'm not going to go into the dark. Okay. So if I'm afraid of a test, then I'm going to procrastinate about studying, because by studying, I'm actually facing it and making myself uncomfortable, not paying attention to reminders to study, and then using superficial study methods. So I have a slide coming up where I'm actually going to compare the ineffective study methods, which are these superficial methods, to the efficient and effective study methods. Sometimes not reading test directions carefully, not managing time well, and not checking for errors. So those are the associated behaviors. But all three feed into each other, making that test anxiety worse. And again, when we feel anxiety, we want to escape it. Okay. So this is just a graphic representation of what was on the previous slide. Understanding test anxiety is knowing that we have these physiological symptoms, the racing heart, churning stomach, and the muscle tension. The cognitive symptoms, including worrying, negative self-thoughts, and confusion. And then the associated behaviors of procrastination, poor study methods, and failing to check our work. Okay. And again, those feed into each other. So now that we know what it is, what do we do about it? How do we manage test anxiety? There's actually quite a few methods, and we could spend an entire session looking at each one of these. The second one is what we've actually done tonight. You're learning about test anxiety, what it is and what it isn't. So one of the things you can do to manage is increase self-compassion. This has become a very important topic in the mental health landscape the last several years, 10 years maybe. Self-compassion is about caring for yourself as much as you care towards other people. Okay? So accepting yourself, without judgment. Okay, I'm anxious about this upcoming test. I accept that. I don't like it. Okay, I wish it would go away, but I accept the fact that I'm like this. And you really have to accept yourself before you can ever make changes over it. So there's a number of things that you can do to increase self-compassion. And I will tell you, there's an entire website and book by a psychologist, Kristin Neff, Neff. And she's written several books on self-compassion. But her website is a treasure trove of information about it. The third item is gaining mastery over those physiological symptoms. So that's why some relaxation techniques like deep breathing and muscle relaxation are so very helpful, because they directly address those physiological symptoms. If you're feeling like your heart is beating fast and your breathing is shallow and rapid, through deep breathing, you're going to slow your breathing and slow your heart rate down. Okay. Now, the thing with any of these, you can't just do them the night before the exam. You need to have, just as you probably take a shower every day and brush your teeth every day, you need to practice self-care every day. And I understand you're busy. I understand you've got an enormous amount of academic assignments, but you can find 10 minutes a day to practice some kind of relaxation strategy. And then the next one is a big one: focus the mind. And that's where mindfulness comes in. And if it's something you're interested in, I would encourage you to tune in next week to the online office hours, where that will be the entire subject. But that's what mindfulness does. People think mindfulness is about relaxation. No, it's about training your mind to be in the present moment. Really be in the present moment, not thinking about what happened this morning or what's going to happen tonight, but what's going on in the here and now. The next item is using efficient study methods for success. So I know you've been in school a long time, but every once in a while it does pay to, like, okay, am I using the most efficient study methods? This might have worked when I was taking anatomy and just had to memorize, but now I've got all these subjects that I have to master in order to prepare for the NBCOT exam. And lastly, developing a positive mindset. Again, when we are worrying about something in the future, there's a tendency to think very negatively about that event. So we end up thinking things like, this will be the worst day of my life, as opposed to, this will be the day I conquer the exam and become an occupational therapy practitioner. This is my opportunity to demonstrate what I know. So thinking positively is another skill that students need to develop. So all of these items on the slide are things that you can do. And these items actually come from a new book that was published this year called Overcoming Test Anxiety. And it actually covers the period from early adolescence to adulthood. So you're all in that category. Okay. So now we're going to turn to the different kinds of study method, what works and what doesn't. So what doesn't work, and I'm talking now specifically about the NBCOT exam. This is not an exam you can cram for. So you don't study the week before 8 to 10 hours a day. You might have done that in anatomy, but it doesn't work for this exam. So that is why at Therapy Ed, we tell students 2 to 4 hours a day over a period of 4 to 6 weeks before the exam. Sometimes students reread material. They've already read it, but now they kind of skim it. They do that with the Therapy Ed book. They do it with the textbooks and even notes that they've had. Rereading is just skimming, okay? It's not truly understanding, right? It's just looking at it. What's different is if you're reading it and taking notes, or you read it and you then quiz yourself on it. Students love watching videos, but that is considered an inefficient study method. Okay, you're just looking at something, but you're not necessarily gaining competency over that subject matter. Studying irregularly, like just before quizzes and tests. Okay. I always tell students when I teach the 2-day course to consider the exam like a marathon that you're preparing for. And so every day you're going to do something to support your best performance in that marathon. Highlighting is a very effective technique if you do it sparingly. But if you highlight everything, then you might as well not bother, because not everything is critically important. Just passively rereading your notes is also ineffective. And then the biggest one is multitasking while studying. So you're sitting in the living room and the TV's on and the dog or cat is in your lap. And the phone, of course, the phone is attached to you because that's what we do. And all of those things that you're engaged in add up to what we call divided attention. So some of your attention is on the material you're studying, but some of it is on all those other things. So studying means studying a book, a pad of paper, or a laptop without the browser on, so that you don't suddenly find yourself shopping on Amazon. And then studying in bed. Again, that might have worked. You might have gotten into the habit of rereading neuro before you fell asleep, or maybe it led you to fall asleep, but it doesn't work. It doesn't lead you to be engaged fully with the material. It's not a state of alertness when you're laying down in bed. So what are efficient methods? Self-quizzing yourself after reading. You have to be able to recall the information, all right? Demonstrating skill to somebody else or explaining something to someone. So you take a practice test and you not only say, okay, the answer is A, but here's why it's A. You explain that rationale. Sticking to a study schedule, taking notes while reading, which is better than just highlighting. Spaced repetition. So, I look at a chart and I'm trying to memorize it. So I look at it. Okay. I think I got it. I cover it up and I try to recall it right away. Okay. That's like 5 seconds later. Then I look at it to see whether I got it right. Then I do that again a half an hour later. Am I still able to remember it? Can I remember it the next day? That's what we mean by spaced repetition. We want to focus during studying without distraction. So if you happen to be studying in a room, and I don't care if it's a closet, doesn't have to be an office, but, putting a sign on the door, Donna's studying until 8 p.m. Do not disturb. And then supporting your posture during studying. You want to be sitting upright, so you want to be sitting in a chair that supports your posture. Okay? So those are the effective and ineffective study methods. So this was from another university, and this added to that earlier list of test anxiety. The physical symptoms are pretty much the same, but they do add that some students actually develop panic attacks, where that is the abrupt onset of intense fear or discomfort. You might feel you're having trouble breathing or even having a heart attack. And then we have emotional symptoms. So helplessness, disappointment, negative thoughts, racing thoughts, etc., comparing yourself to others. Just as before, not everybody is going to have all of these symptoms, and it doesn't matter how many you have, but kind of taking inventory of what's bothering you. So what are some possible causes of test anxiety? The first, of course, is fear of failure. We approach an exam and we know that if we do well, that, can be very motivating. But when students don't do well, sometimes they equate that with being a worthless human being, which you're not. You had trouble with this test, not your value as a human being. The next cause of test anxiety is lack of preparation, waiting till the last minute to study. That leaves you feeling very anxious and overwhelmed. Poor test history. Some students will tell me they've never been a good test taker, that's been part of their academic history, so to speak. And while we don't want to dwell on the past, what we do want to know is, well, what did you do about it? Because some of those same methods might be helpful now. High pressure. I've already said this is a high stakes exam. Your future as an OT or OTA is depending on it. So this can increase your anxiety. And perfectionism is another. So there has been several research studies on perfectionism. We know that high perfectionism and high self-criticism does lead to high test anxiety. So those students tend to do worse on exam. So if you are someone who struggles with perfectionism, try to let it go. Now, I know that's easier said than done, but understanding it, maybe even getting some counseling for it, reading about it, etc., is actually very helpful. And in the references at the end, you'll notice that there is an article about perfectionism in OT students that's been written. So how do we reduce test anxiety? Well, the first is to be prepared. So studying weeks in advance. And again, for this NBCOT exam, we recommend 2 to 4 weeks in advance. And you want to make a study schedule. Now, a lot of students say to me, I've been in school a gazillion years. I've never had to make a study schedule. And to that, I say, you've never taken an exam like this. So make a schedule and write it out, not putting it in your phone, and tacking it up somewhere so that it's in your face every day. We want to study effectively, okay? Which means using some of those more effective and efficient study methods. You want to engage in self-care, so make sure you're getting adequate nutrition and rest and exercise, and somehow managing to squeeze in some social activities. You can create a calming worksheet, and on this you can put things like motivational quotes, why you are likely to succeed, reminders to breathe, pictures of people important to you, etc. Again, it's individualized to everybody, but sometimes, particularly those people who are visual learners, that really helps them. And certainly knowing what's going to be on the exam, talking to your professors may help. For the NBCOT exam, reading everything on the NBCOT website, reading test materials that actually tell you what's on the exam, not specific items, but how to best prepare. Those are all going to be very helpful. So just before the exam, you do want to get a good night's sleep, 7 to 9 hours. And sometimes I tell students the day before the test, get up extra early, a couple of hours early, do something physical during the day so that when nighttime comes, you're good and tired and you can get to sleep. You do want to eat something that does help with focus and attention, and water helps you stay hydrated. So you want to make sure you have that during the exam. You do want to avoid too much caffeine. It can have a negative effect. Try to have all your study materials collected in one area so that you're not rushing around when you're trying to recall something. You can play some calming or familiar music to help you relax, but you don't want to play music while you're studying. Again, this is multitasking. Then you're listening to the music and not paying attention to the material. Only half of your attention is on the material. Get to the exam early. If you are distracted by noise, invest in some foam earplugs. That will help. Don't let the exam define you. Right now, the failing rates on the NBCOT, OT, and OTA exam are quite high. 32% of students are failing on their first attempt. And that was data from 2024. But that does not define your self-worth, okay? It's one exam. You are going to learn what you did wrong, and it will help you better prepare for the next time. And then give yourself a pep talk, okay? Reframe your anxiety into excitement. Tell yourself you're excited about the opportunities that passing this exam has for you. During the exam, calm your body. That means, take a small break right at your desk. Breathe deeply from your belly. You can tighten muscle groups and relax them. You can shrug your shoulders. There's different small exercises that you can do that will relieve muscle tension if you have them. You can close your eyes and count to 10. Sitting up straight will also help you be more focused and alert. And you don't want to slouch. All right. Sometimes students in the classroom are all bent over and their head down on the desk. That's not a posture of alertness and confidence. So we want to sit up straight. And you want to focus only on the present moment. You want to keep yourself grounded. Okay. Avoid thoughts about the future or the past. For people taking the NBCOT exam, the passing score is 450. It doesn't matter if you get 450 or 600. You passed. You only take it once. That's it. Okay? So it's not like you have to do it again to get a better score like maybe you did on the GREs. If you do have negative thoughts during the exam, you want to replace them with positive ones. Okay? Don't go down the rabbit hole of negative thoughts. You want to stay focused on the current task and on the current question right in front of you. Keep realistic expectations. Again, you don't have to get a perfect score of 600. All right, 450 is quite fine. And focus on yourself and what you're doing. Try not to be distracted by other people coming in or out of the room, or comparing yourself to other people as they come in or leave the room. Now, this is just important to pay attention to. If your test anxiety is really out of control, okay, it's really leading to a lot of physiological and behavioral symptoms, it could be related to something more serious. Please get yourself some professional help for that, okay? You do not need to suffer, okay? The strategies that I'm sharing with you might help, but if they don't, or it gets worse, seek some professional help. Every college campus has a mental health center. Take advantage of it. Perfectionism, I mentioned before. And that's basically a personality style where you strive for no flaws, for excessively high standards of performance. In other words, you won't accept anything less than an A. An A minus is absolutely devastating to you. So perfectionism can either be adaptive or maladaptive, but usually it's maladaptive. All right. And people end up not having satisfaction from their own achievements. So you don't feel good when you do pass a test or succeed on a lab practical. So the problem is that perfectionism leads to behaviors that undermine your performance. So again, perfectionism often causes students to redo assignments, neglecting their health, avoiding exercise, staying up late, worrying, obsessing about getting a perfect score, and that just leads them to feel overwhelmed. Procrastination and time management also is going to have a negative effect on academic performance. So being late on assignments, not, being organized, not keeping to the plan you put in your planner. And this again is going to lead you to poor academic performance. It's going to lead you to more test anxiety because you're not going to be prepared. So if procrastination is an issue for you, do something about it now. The self-assessment I mentioned earlier, whoa, I went the wrong way, is here, and the items are on this slide. So the closer I am to a major exam, the harder it is for me to concentrate on the material. Or when I study for my exams, I worry that I will not remember the material on the exam. So I would encourage you, if you're curious, to take this assessment. Be honest with yourself. Again, there's no right or wrong score. It's how you feel. Score it. Look at the feedback provided and do something about it. Whether that's seek out counseling or talk to one of your instructors or your advisor or something. Preparing for the test, you want to approach the test with confidence. You've been in school a long time and you've succeeded. You've been on field work. You've succeeded. You need to visualize future success. You need to plan ahead. So again, having a study schedule. Participate in study groups. You're going to do the bulk of your studying individually, but once a week or so, get together with classmates, quiz each other, talk about those rationales, make sure you understand the material. Have a regular routine that includes exercise, nutrition, and adequate sleep. Practice relaxation daily. Avoid substances that can increase anxiety. So alcohol, caffeine, nicotine, and to that I should add sugar, salt. Those are going to raise anxiety level. Despite most students saying they're going to be too nervous to eat the day of the exam, it is a good idea to eat a healthy meal on test day. But try to avoid processed foods and sugar. Bring a nutritious snack with you and water. Get to the test location early. Being late is only going to raise your anxiety. And strive to be in a relaxed state of concentration. During the test, you want to reduce your distractions if possible. Budget your test taking time, keep track of your time, but not overly compulsive about it. And don't compare yourself to others. Somebody gets up and walks out. They're done with their test. Well, you don't know what tests they were taking, and it doesn't matter. All that matters is you and your test. And there's no reward for finishing first or finishing in 3 hours instead of 4 hours. if your anxiety level continues to be excessive, think about some of these other strategies. Practice breaking anxiety, okay? And that means practicing various anxiety reduction techniques. Things that you probably teach your patients to do, I'm asking you to do for yourself. Think about your learning style. What kind of ways do you learn best? And you want to incorporate those study methods into your plan. Learn test-taking skills. And this is why it's helpful to take a course that includes information on test-taking, what to do and what not to do. Continue daily practice of relaxation techniques. And get some professional help if you need. There's no stigma with that. There's no downside to that whatsoever at all. I will open it up to questions. I want to reiterate that next week we're going to focus on mindfulness, what it does, and how to actually start practicing it. My email address is there if you have a question that you would like to ask me. But I'm wondering if anyone has any questions at this point about test anxiety. Just unmute yourself and speak up. Well, either I did an incredible job of presenting this and you have no questions, or nobody wants to ask a question.
Hi, Donna. I do have one question.
Thank you.
Um, I was wondering if there was any information about the connection with anxiety and music, if there was anything you found of specific kinds of music that could help, not necessarily with studying, but prior to the exam, but maybe like listening to a song for a certain type of music for 5 minutes. I've heard possibly classical music, but I wasn't sure on that.
So there is quite a bit of research on the effect of music on anxiety, on academic performance, on a lot of stuff. The only fact that I can recall right this minute is that there's this concept of entrainment where your body, your heartbeat actually adjusts to the beat of the music. So the faster the beat of the music, the more stimulated you're going to become. So it would stand to suggest that if you're trying to relax, that you do listen to a slower beat of music. Obviously, songs that have lyrics are going to have a different kind of impact because you're tuning into the words. The thing that I emphasized in this presentation is you can use music perhaps as a warm-up, but you don't want to use it during studying because it will be a distraction. A lot of people think, oh, it's going to help me studying, but no, that's not going to happen.
Thank you.
You're welcome. Any other questions about test anxiety or anything I covered? Somebody asked where the link was to the West Side test anxiety scale. So you can do one of two things. It is in the PowerPoint, which will be posted. Or you can just Google West Side test anxiety scale. And there are a number of links to it, including one that automatically scores it for you. But it's only 10 questions, so it's not hard to score. These are the references, and I want to have enough time to go over the question of the week. So we usually spend a few minutes going over this so people understand the rationale for a question. So this one, an OT practitioner provides services in a supported education program. It is important to know what a supported education program is, and there are different types of them. So that's basically when there are supports built in. So for example, when I lived in New York, we had a program in Nassau County called College Bound. So students who had been diagnosed with a mental illness were given supports to go back to college. And so there were certain courses that they were enrolled in, and then they were provided help, which could included as much as they needed, note takers, tutors, whatever it was that they needed. Now, in this case, it's saying several participants report difficulties managing their required coursework and falling asleep at night due to the inability to not think about incomplete course assignments and impending presentations. Which behavioral approach is best for the OT practitioner to recommend that program members use to address their expressed concerns? So the first answer talks about modifying the sleep environment to block light and noise. The second one says engagement in relaxation activities throughout the school day to decrease stress while in class. C says advocacy for the reasonable accommodation of extended time for the completion of coursework. And D says establishment of pre-sleep routines that include the composition of a to-do list and then letting it go. So the correct answer is in fact D. We want to establish a pre-sleep routine. We want to, instead of worrying about all the things that's on your to-do list, we want to put them down on paper and maybe even rank order them. So the idea is to put that down on paper, so then you're not laying in bed thinking about it. That is a behavioral approach. And what's significant about this question is that it says it's asking for a behavioral approach. So a modification of a sleep environment would not be a behavioral approach. That's an environmental modification. So just be careful with NBCOT questions. Sometimes they actually specify an approach that you need to use or a frame of reference. And then that's going to dictate what the correct answer is. So I don't know if anyone has any questions related to this week's question of the week or anything around supported education programs or behavioral approaches or anything. The floor is yours.
I have a quick question.
Yes, Kyle.
Where will the PowerPoint be posted on Therapy Ed?
It'll be in the online office hours section.
Okay, thank you.
You're welcome. But the recording will be there, and you're going to be able to see the recording and hear me talking, doing essentially voiceover PowerPoint. So. Other questions? Was this helpful information tonight?
Yes, it was very helpful. Thank you, Doctor. I appreciate it.
Good. Thank you for that feedback.
Mhm.
Anything else that people are struggling with as they prepare for this exam? Any areas of concern about the exam? All right. If there are no further questions, then we're gonna end for the night. Thank you again for signing up tonight and showing your willingness to learn about something new. I hope you find the information helpful, and I hope to see you at future Therapy Ed events. Good night.